Hello everybody, my name is Alex Hughes. I am the lead nurse practitioner here for Austin Urology Institute. This is your pre and post-op video for Barrigel and Fudicial placement. So this is a procedure that's done in the surgery center for patients that are going to be getting radiation on their prostate for prostate cancer. So what this is, it's a gel that goes between the rectum and the prostate so that when they do radiation, the radiation doesn't go through the prostate, hit the rectum and cause like fecal urgency and things of that nature. Fudicials, these are little gold placards that go into the prostate so that the radiation oncologist has a target to actually complete the radiation. So this procedure is typically done in about 30 to 45 minutes. It is an anesthetic procedure, so you are asleep for it, and it's done in the surgery center. We do ask you to do an enema beforehand. So if you have a morning procedure, we want you to do the enema the night before. If you have an afternoon procedure, we want you to do the enema in the morning of your procedure. And that's basically because we have to use an ultrasound wand to look at the prostate as we're doing the procedure. So it's best to have any kind of stool cleared out of the rectum. So if you can kind of imagine it here, this is your rectum, and then here is your prostate. So this is an exaggerated view of it, but when you get radiation therapy, you have to go at the target, the prostate. And sometimes that radiation will actually go and hit the rectum. So what we do is we place a gel between the rectum and the prostate. This is called Barrigel. And we do that while you're in stirrups, and we have the ultrasound wand actually looking up the prostate. And while Dr. Shaw is doing the injection, he's actually watching the prostate lift up. So the Barrigel goes between the prostate and the rectum so that the radiation doesn't get hit. And then while he's actually doing the Barrigel placement, he puts the gold placards into the prostate. So he typically does 4, 2 on each side, so that the radiation has a radiation oncologist has a target for the actual prostate and for the prostate cancer and the radiation. The gel will naturally absorb into your body, so you don't have to have it removed. Your radiation oncologist will do a prostatic MRI to make sure that there is a good placement of the actual gel and the Fudicial placards, and that will be all orchestrated with you and your radiation oncologist. Again, this procedure takes 30 to 45 minutes on the long end. Just make sure you are doing your enema and any kind of pre and post-op medications that we send in. Just make sure that you're taking them. I have yet to have anyone complain of acute pain for this. I think you can get by with ibuprofen, Tylenol if you even need it. Sometimes just even an ice pack to that area is really good for it. But just make sure you reach out to your radiation oncologist after you do your procedure so that they can get you on the schedule to do their imaging.